Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the ankle. It is the external rotation stress test. This test came from a paper in 1991 by Mark Boytim, and he was wanting to develop a test to differentiate between an ankle sprain that was a lateral ankle sprain and a syndesmotic ankle sprain, because he was saying that the syndesmotic ankle sprain, please forgive me on the pronunciation of that, so these players took longer to recover, so he wanted to develop a test that could accurately diagnose this one versus a lateral ankle sprain. Now you may be saying, well Matt, what about the deltoid ligament with this test? That's an interesting thing. It wasn't discussed in the early papers for this, but through some cadaver studies, they did find that the deltoid ligament is involved when it comes to like medial ankle stability, or just like, you know, ankle stability. So they were finding like, oh, if you have an issue with the deltoid ligament and this test does stress those structures, you could have some other issues going on with ankle instability. To perform this test in the original paper, the person is seated, Mateo is standing, but he prefers to do that. The knee is at 90 degrees and the foot is in a neutral position. They are gripping around the foot on the medial side, stabilizing up here at the tibia, and just externally rotating the foot, just bringing it in. And they said a positive for this test is pain on the outside of the leg or on the interosseous membrane. Getting into the research for it, it's a little bit all over the place. If you start looking it up, it's kind of all over the place. There's variations of the test. It gets a lot into like cadaver studies, and they're doing this stuff and saying, oh, what's going on? Like I said, it's all over the place. But there was a meta-analysis in 2023 that did compare a lot of these studies, and it was also looking at the external rotation stress test for the deltoid ligament injury, or the syndesmotic instability. And they did find that for the deltoid, it had like a 63% sensitivity, a 64% specificity, but for the syndesmotic, it had like a 33% sensitivity and 100% specificity. So it's kind of all over the place. Another one did talk about, and I referenced them all down in the comments, that there's not really a good gold standard for diagnosing this instability, but they said that this is a pretty good test to use that's non-operative. So there seems like there's a lot of discussion on like testing for that instability in the ankle and what's involved and really how to diagnose it. So it looks like there's some stuff going on in there. So that looks pretty interesting. But that is the external rotation stress test. Let me know, what do you think about it? Do you use it? Do you like it? Do you think we need to look more at that medial instability? Anyway, let us know down in the comments below. And until next time, take care of yourself. Take care of your patients. We'll see you then.